As a nurse, I had a patient prior to the Affordable Care Act who needed cardiac bypass surgery. And he was not worried about his life-saving surgery. He was worried and fearful for the catastrophic financial impact it would have on his family. As I sat with him and talked through his decision, it was one of the hardest things I've ever done as a nurse. There's a lot of people right now that are receiving care for chronic conditions, cancer, and they're fearful that their care could be taken away. In Ohio, the opioid crisis, Medicaid expansion, if that gets rolled back, that's millions of dollars that is currently being used to fund taking care of patients. 200,000 of them are currently seeking treatment for opioid addiction. Additionally, it's projected that 81,000 healthcare workers will lose their job if this passes. That's an incredible hit to a system that's already has a shortage of nurses, has a shortage of healthcare, a shortage to access. This is not a political issue, it's an ethical and moral one, and as nurses, we find it our responsibility to advocate, and this is advocating for them at the highest level.
He was referred to a surgeon to have the cancer removed, and today, Kenrick is cancer-free, all because he was covered by Medicaid and able to access quality primary care when he needed it most.
The policies that are made in the halls of Congress or the Senate really have big implications for what we do on the front line. I practiced in an era before the Affordable Care Act, and it truly breaks your heart to tell patients that they have a terrible diagnosis and to scramble to try to find appropriate care for them. It's not what I signed up for when I became a physician.
Who will lose access to health care.
Medical caps have been on my mind as a mother of a child who was born a premature child, who met his $1 million cap before he ever came home from the hospital. This is an issue faced by millions of families, and now they're looking to put the caps back on so people making over $250,000 are paying less taxes. Call your senators, don't let this pass.
With the rollback of the Affordable Care Act, there'll be a lot of patients that won't be able to afford insurance. And so what we'll probably see is a lot of people waiting until they're really, really sick and coming to the hospital. Then we'll be looking at patients having 8, 10, 12-hour waits in the emergency department for care. The current act, to completely repeal it and to leave these folks without coverage and without care is definitely the wrong way to go about it. So we need to all stand up and use our collective voice to advocate for what's right.
There's nowhere we'd rather be than here today to really represent our patients first and foremost, and our colleagues all around the country. In the last several years, I think all of us have seen our patients finally get access to insurance, and through that, treatment to medications that they never had access to before. The effect it's had positively on their families, on their communities, on their friend circles. We've seen patients, newborns and children, gain access to treatment, and all that's going to be taken away if this bill and this legislation moves forward. We talk so much about the moral crisis that we're facing. This is a true test of our generation about where our moral priorities are.